quite a lot of people have been in the UK and got their second jab there because they've had these walk-in clinics. Does that affect your supply here? Do you still get whatever was going to be issued?
No.
Do they know what you've had?
The UK doesn't cross off according.
So you might have a few more spares.
I think you'd probably find that would actually be more paperwork than it's
so you got more
spares
spares
involved.
More people have it across
to cool down. But like I say, we book according to supply, and we always have done to minimise any vaccine wastage.
How is your supply?
Sorry?
How's the supply going?
The supply is steady. There's still occasional bumps. But obviously this programme is now winding down. It's not a never-ending supply. The UK is bringing its programme to an end in September, and that will mean ours will terminate at the same point, because obviously the supply at that point will cease.
Massive talk about mixing and matching coming along, and you've got the other potential vaccines added to the group. Again, it'll be a UK policy that we will just adopt, will we? If we mix and match with the booster or the second jabs eventually.
Yeah, being a small island, we're not in a position to make clinical judgments at that level. There are professionals in the UK in that field who are able to advise.
You say that, but you have to sign off each one as they come along. We had that hiccup initially because you took more protocol to get things done.
What we have to sign off is that we're comfortable that the correct indemnities and everything are in place. So that was the paperwork that we were waiting for at the time, was the indemnity paperwork.
You're keeping Noble still on standby in the sense of when people go up there, can't take visitors in, can you? It's all masks and all that sort of thing.
There's still a cautious approach around healthcare settings.
How long's that going on?
Again, it will be a wait and see. It'll be wait and see which direction it goes in. But as we come to live with COVID, we need to start being able to treat COVID as we do other respiratory diseases that circulate in the community, and that involves in how we deal with things in healthcare settings as well.
I'm sure you listened to Boris Johnson the other day. The amber countries are going to go on the OK list soon as well, and that sort of thing. But I mean, the question was obviously is at what tipping point do you have to change your direction? I mean, he was asked that, didn't really have an answer, but we can see the deaths are low and that sort of thing. But do you have that sort of system in place here as well? If things did get out of control, obviously as winter comes, you're going to be under pressure with just flu and other things as well.
So it would be based around hospital capacity. We've always been very, very clear on that. It would depend upon if we're seeing the health services under pressure. You mentioned there about winter flu. The UK, for instance, normally sees about 1,000 admissions a day during the winter due to other respiratory diseases. There is a clear, from my mind anyway, that you look at the reports, it's clear that the vaccine has broken the link and certainly reduced the amount of deaths and hospitalisations. You look at countries such as Israel, the UK, that are far ahead in their vaccination programme. That is absolutely clear. We're far ahead in ours as well. So it is providing the maximum protection. And again, we've got to go back and remember what all the lockdowns, what everything else was about. It was about protecting the NHS, making sure that we didn't see the scenes we saw on our TV coming out of Italy, where you had patients on stretchers in car parks, having oxygen cylinders attached to them. That's what it was all about buying that time to find a vaccine or some other way of controlling the virus. Now that the vaccine programme has rolled out and that this first phase is nearly completed, we can make different decisions.
What's your mailback box like at the minutes?
Well, so far today, I was just on my emails when you came in.
I know, you never stopped typing.
It's actually 271 emails since 8 o'clock this morning so far. So the odd few. The mailbox is still quite high. People have queries, and also, there are people out there who, quite rightly and understandably, are still concerned and feel maybe things are moving too fast. There's other people who feel things are moving too slow and we should open up. And it's getting that right balance. There is no exact science to doing this. It's easy when you shut things down because you just shut it off. Turning everything back on was always going to be the hardest part, particularly around borders, because borders have unmistakably been our biggest defence throughout this entire period. So it was always going to be difficult at the border phase of getting the right approach to opening up our beautiful island again. Just
give me an example. I mean, like you went in the chapel at St John's. I mean, some famous person was a well-known person there as well. But you also, because I looked inside and it was full of capacity, wasn't it? Everyone's sitting there. What happens if someone comes out with a positive now in there, do you all have to then scurry away? Or?
No, so it would be contact traced in the usual way. So
Yeah.
it'd be high-risk contacts. That would be the people immediately around that person
How close?
who have actually spent a substantial amount of time with that person. So generally the people who are next to them.
Yeah.
But also, of course, as I've said, with isolation, vaccination status now plays a part as well. So it's different for those who are 2+2.
Okay, just finish with it. When do you think everyone will be vaxxed? Because we're doing well. Then there's that 2-week stoppage. The UK's now reduced their level again, haven't they? From first to second. Are we going to follow that? I should ask you that as well. But when we all coming to an end on this?
So phase 1 is due to complete in September.
Which is on time, on message.
On message. Exactly as we said at the very beginning of the programme.
You're not going to shorten up that period?
We said it was going to be a 9-month. There isn't the supply to shorten it.
Right.
Again, it would cause, as we discussed about the two-week, the reason we had that 2 weeks was because we moved everyone from being a 10-week gap to a 12-week gap to prioritise first doses. And as I say, we booked a maximum supply we know we're going to get. So there isn't the ability to move people forward because, one, it would just cause absolute chaos, but also there isn't the supply to do it.
And I know you don't need much sleep, but do you sleep at night in a way that you think we're okay?
As you say, I don't tend to sleep much anyway.
You send me messages at 2 o'clock in the morning if I ask you something. It's amazing.
But I don't tend to sleep much anyway.
Yeah.
But what worries me actually is the general waiting lists. If I've got to be crucially honest, people always say to me, "You must stay awake at night worrying about COVID." I said to the Policy Review Committee, the Social Policy Review Committee only a couple of weeks ago, actually the thing that keeps me awake at night is the worry about the general list that is built up over the COVID period. Yeah. So Manx Care is working very hard to try and work on plans to get the waiting list down. But obviously we're dependent on bringing extra resource in, and other countries, including the UK, are in a very similar position to us.
But people mustn't hold back, right? If something's wrong,
most
they must go.
Most definitely not, and that's a very important message, Paul. I'm glad you've given me the opportunity to say that again. Yeah. If people are feeling ill or they're feeling that something needs to be looked at, don't hold back just because of this pandemic. Everyone seeking normal medical treatment should still do so.
Will 111 be there forever?
111 I'd actually personally like to keep. Obviously it won't be my decision to make because it needs funding, but 111 I actually think is a very good service, and I think there is actually a call in the island for a medical line for people to be able to call, even involving general queries. So personally, in one form or another, I would like to see us keep 111.